A team of researchers who failed to disclose pharmaceutical industry ties in an arthritis drug study published last May have apologized to the Journal of the American Medical Association (JAMA). The study, conducted by Mayo Clinic professor of medicine Dr. Eric L. Madison and colleagues, examined the association between tumor necrosis factor alpha blockers (TNFs) used to treat rheumatoid arthritis and an increased risk of cancer and infections. Madison's study found that certain TNFs, including Remicade, Enbrel, and Humira, were linked to an increased risk of cancer, particularly lymphoma, as well as a higher risk of infection. However, the researchers failed to alert JAMA editors that Abbott Laboratories, the maker of Humira, had been allowed to review the paper prior to publication. The researchers also failed to include a TNF drug made by Wyeth in their study, while the researchers were simultaneously working with the drug firm on a separate study. Finally, the Mayo researchers accepted $25,000 from Amagen, maker of Enbrel, for fellowship education training of one of the study's co-authors. Madison and his colleagues say the science behind their study is sound, and the omission of their conflicts of interest was an oversight. "This was really a very embarrassing thing to me," Madison said. "This occurred due to my inattention to our disclosure statement when we submitted our original paper. There were mistakes in the disclosure, not because I intended to mislead them, but simply because I was negligent." Madison says he informed JAMA editor-in-chief Dr. Catherine D. DeAngelis of the error a week prior to the study's publication on May 17, 2005. However, DeAngelis says she was first notified of the conflicts by one of the drug companies involved. "It was very nice of Madison to do it after the fact, since he knew we were about to initiate an investigation because someone let the cat out of the bag," DeAngelis said. "We are very serious about it. I don't like it when people don't fully disclose. I wanted this letter of apology." In July, DeAngelis announced that JAMA had updated its conflict of interest disclosure policy to help improve the transparency of reporting of potential conflicts of interest and to encourage more accurate and complete disclosures. The importance of disclosing conflicts of interest are a major concern in medical research. When researchers have financial or other ties to the companies that make the drugs or devices they are studying, there is a risk that their research will be biased in favor of those products. This can lead to patients being prescribed drugs or devices that are not the best for them, or that may even be harmful. It is important for researchers to disclose all of their conflicts of interest so that readers can assess the potential for bias in their research. JAMA's conflict of interest disclosure policy requires researchers to disclose any financial or other ties to the companies that make the drugs or devices they are studying. Researchers must also disclose any other potential conflicts of interest, such as personal relationships with company employees or stock ownership in the company. Conclusion: the apology from Madison and his colleagues is a reminder of the importance of disclosing conflicts of interest in medical research. JAMA's updated conflict of interest disclosure policy is a step in the right direction, and it will help to ensure that readers can trust the research that is published in the journal.